Good afternoon, everybody. Welcome. My name is Bernadine Mavungu-Jerengama. I am the Senior Communications Associate at the National Association of Community Health Workers. Welcome to Session B. This is using CHW-engaged strategies to build CHW and community capacities while addressing social determinants of health. So we are going to kick things off with our first speaker today, and that is Silvia Ortega. For almost a decade, Silvia has worked in the nonprofit sector, earning certificates in professional life coaching and community health work from Loma University Health and El Sol Neighborhood Educational Center. Through her work in maternal health, she became an integral part of the accreditation process for the Home Visitation Expectant Mothers Program. She is also in the first graduating class to pioneer clinic-based community health work and established the first program in Loma Linda University Children's Hospital NICU department. Silvia has devoted her personal and professional life to her dual passions for health and education. She has learned that the core issues facing our society all stem from systems that influence communities to make poor lifestyle choices that result in poor health and lack of education. She believes firmly that parents are their children's first teacher and their home is their first school. Thus, part of the solution is the understanding that health begins as early as pregnancy and the foundation of a great education begins at home. Silvia is a former president of 2 educational boards and is committed to making an impact in the life of the most vulnerable students and families in our community. So to our participants, as we move through this presentation, if you have any questions, please put them in the chat. The chat should be docked on the right side of your screen. We will save a little bit of time at the end to answer any audience questions, and we may answer some during the presentation in the chat. So Silvia, please take it away.
Thank you so much for that warm introduction. And I cannot do this presentation alone, so I would also love and I'm honored to be here with some current graduates of ours and our leadership as well. And at this time, I will let them introduce themselves. Sam?
Oh, good afternoon, everyone. My name is Sam Ositome, and I am a community health worker over here in South Central Los Angeles. I work for the organization called Kitchen Community Care Clinic.
Hello, everyone. My name is Kevin Porras. I work with IHP at the Riverside Community Resource Center. I have just finished the community health worker program, and I'm excited to be here today.
Hello, everyone. My name is Pamela Fernandez. I am an instructor and a CHW ally here at Promotores Academy, Loma Linda University in California.
Hello, everybody. My name is Lily Lee. I'm the director of the Promotores CHW Academy at Loma Linda University, and I'm here to support the team, deliver a wonderful presentation to all of you across the nation. Welcome.
Hello, everyone. I'm Nelly Leon, and I'm the program manager at the Promotores Academy, and happy to be here as well, just supporting our wonderful team and delivering information to all of you present. Thank you for being here.
Well, thank you, everyone, once again, and we're very, very excited to be here to share just a little bit of what we are doing here at Promotores in San Bernardino, California, what we're doing to support the movement, right, through training. And some of the objectives that we're going to cover today are recognize the use of CHW-engaged strategies as an effective approach to maximize on CHW knowledge, skills, and abilities across various roles and workplace settings, as well to describe at least one CHW strategy to build individual and community capacities, and describe at least one CHW-engaged strategy to address social determinants of health. And just to give you a heads up, what we're going to be seeing today is some of hands-on application strategies. Our graduates, along our co-workers here, will be demonstrating these strategies and how they work and how several tools and skills can be put together. Next slide, please. So the question, why are CHWs on the spotlight and drawing so much attention? I am sure that each one of you in this audience are very well versed and can give a lecture on this topic, right? But we'd like to emphasize that with more studies that support the fact that addressing social determinants of health can improve the health of populations, CHWs are on the spotlight as they are exactly what the healthcare system needs due to their ties and understanding of their communities and their ability to be the link between the community and the healthcare and social systems. So how can CHWs make the most impact? CHWs can make the most impact by bridging the healthcare and social gaps by addressing non-medical factors that totally influence overall health. They do this by applying very unique set of skills at various settings and where their role is purposely integrated, comprehended, and value, they can definitely make the most difference. Next slide. As we when we're looking at population health, we can see that healthcare cost increases as health risk in population rise. So about 50% of healthcare cost is attributed to the 5% high risk populations or super utilizers. So when we keep in mind this, these populations include those who encounter psychosocial and socioeconomic barriers, those who have multiple chronic diseases, and live in poor and disadvantaged communities. With the quadruple aim in mind to improve population health while reducing cost, maximizing the role and skills that CHWs bring on the table, altogether these elements can address the barriers faced by these populations of this group, especially the 5% high risk populations, and not only this group, but also those who are at medium or low risk. By CHWs providing health education, providing prevention efforts at various levels, and bringing in all of the skills and talents that they have. Next, just to look briefly some statistics, we have highlighted San Bernardino County and Los Angeles as these are the regions where most of our graduates serve their communities. And overall disparities are high among certain populations and attribute to overall health outcomes. We can see here, looking at this data, that, for example, premature death and racial disparity in education attainment is at higher numbers in these regions than at national median. So this information not only give us an overall look where we need to go and help, but also help us understand where the need it's at and what skills to bring in to address those needs. Next, please. And as we keep looking at what's happening nowadays, CHWs bring a unique set of skills. We're very, very aware of that. The pandemic has been proof that CHW strategies are highly valuable to prevent and address a plethora of health and social issues. Just for example, we can talk about contact tracing efforts, vaccination efforts, resource distribution for access to care, physical and mental health care, food assistance, financial support, etc., and many more actions supported or led by CHWs have made and continue making a huge difference during these times. We need community health workers to strengthen the public health response, not only to the current pandemic crisis, but also for the mental health crisis that we are seeing as a result of this pandemic. And now I will pass on the microphone to Ms. Ortega, and she will share a little bit more about equity and social determinants of health.
Thank you so much, Ms. Fernandez. And yes, as we've been mentioning, right, we're talking about health and social disparities and inequalities, but I think the invitation now us moving forward is this illustration that you can see here and making a big focus on social justice. We cannot talk about health without talking about what's going on in our current communities. You know, and events, tragedies such as George Floyd and, you know, what's happening with our Asian American brothers and sisters, tragedies that we see on and on. We cannot continue to work in community health work without addressing the root issue, which again, for a lot of us, we experience, like for many of you who got to hear the introduction, I was able to work in the homes and the communities of families that I got to see that there's discrimination, unfortunately, still going on, right? And a lot of these systems can't continue to address health without first addressing and fixing the root issue. And why do we talk about this? Because community health workers know this, they live this, they are passionate about getting to the root issue. So we'll continue through our presentation to share more on how community health workers get to the root issue. And as I like to call them rootologists, because again, they get to the root issue so that the fruit of those roots are positive and influential for our communities. If we can go to the next slide, please. And again, we're preaching to the choir here, but we know about social determinants of health and their impact. We know that 20%, only 20% of medical care is related to the health of a community member, right? And we know that the rest of it, which is 80%, a high 80%, is based on the social, the behaviors, the lifestyles, again, that we correlated back to community health workers, that not only are they trained, but they've lived these experiences. They have some of these social factors that are contributing to their own health as well. And for that reason, they can create the most impactful transition for community members to live the most healthiest and productive lives that they can. And throughout, again, our presentation, we'll touch on more of the impact community health workers continue to make on social determinants of health. And again, the rich experiences, life experiences that they have that just bring all of this to life. Next slide, please. And as we continue to talk about integrating community health workers, social determinants of health, and obviously, as we mentioned, the social justice component, a health organization should be asking themselves these 5 questions. So at this time, take a picture, screenshot this, as it is highly important of being able to, again, helping address social determinants of health through your work that you do with community health workers. And as we can see, we're talking about prioritizing social determinants of health in individuals and patients, so that we'll again talk about building capacity for our communities and for also the individuals in our communities. And we know that, again, social determinants of health, for us, it might be a term that we always hear it, but in the healthcare world, it's not so much. So again, community health workers, as they're being trained and experience social determinants of health, they get to go, when they're integrated, to clinics, to hospitals, to even just health organizations with resources that will provide a linkage between the community and the individuals, again, because they know this, they live this. Next slide, please. And this is one of my favorite ways to express how important this is in the integration of community health workers in clinics and hospitals. This is one of the slides that we presented in one of the public health conferences as well. We have different perspective. A community health worker works in a team, right? Their approach is bilateral. They're not above anybody else. They are working right aside with a community member, and that just again makes the connection, the trust with the community member even more. And the perspective of employers should be that, that their community health workers don't work in a hierarchical manner, right? They're working side by side, and a lot of practice with cultural humility, and being able to, again, at the end of the day, create that bridge so that these community members are invited back to the healthcare system if they need so, and once out in the community are just integral part of the community and are able to live, again, healthy and productive lives. Next slide, please. And so as we continue to build that integration through building the capacity of community health workers, it's huge. It's critical to always invite community health workers and being able to share their perspective, because it's much different, as we just saw in the last slide, of employers, of clinical individuals, right? So they're very solution-based. They see a problem, the community health worker will see the problem but at the same time, we'll be able to work based on a solution. And community health workers love, again, to be in a team. That's their value. They work based off of each other and being able to build teams, and they know they can't do it alone, so they rely a lot on the team. Again, creating solutions. Making a community health worker happy is inviting them to be part of the solution. There's nothing that can make a community health worker more happy than you valuing their perspective and being part of that solution as well. And again, for these employers who are integrating community health work, it's very important to adapt to their workflows and review constantly policies and protocols for community health workers. And as we see here, community health workers are essential workers who can deliver human, high-touch healthcare for the care team and organization. So that's always a plus. And we're always talking about return on investment. That's exactly what community health workers can do for you all. And at this time, we would like to speak a little bit about more professional characteristics of community health workers, and I will turn it back to Mrs. Fernandez.
Thank you. Yes, so as CHWs prepare for their professional work and going into the workforce, training sites need to come along and must commit to ensuring high quality standards for the CHWs. And we can see just a list of things here. The CHW should acquire didactic and hands-on skills. We know that CHW work is very skills-based, and adding into what already is there. We believe about the lived experience that CHWs bring on the table. So building upon those already existing blocks are some of the key characteristics of building a CHW workforce. Also, continue encouraging the patient-centered approach, skills and strategy, and not just patient-centered, but strength-based patient-centered approach. And due to the nature and scope of CHWs, they also need to receive, as we mentioned, the didactic and hands-on training to prepare them for the workplace. And also, it's critical to retain competencies that support and sustain health equity for our communities. And CHWs can do that by understanding or continue applying the social determinants of health assessments of their communities and bringing that information back into the healthcare system, into the care teams or the teams that they're working with at the community-based, school-based, and so on. So next slide, please. So recognizing traits and personal qualities of successful CHWs is very, very important. And those who have been in this field for years, you know that. Earlier on, Ms. Wanda Hernandez-Gordon mentioned something that really called my attention. And she said that some are trained and others are called. And definitely successful CHWs are called. There are people who have the passion and have in their heart to serve their communities. And so coming along, personal qualities as well as the enhanced skills, it's very, very important for successful CHWs. Next, please. So at Promotores Academy here at Loma Linda University, San Manuel Gateway College in San Bernardino, that's where we are located, we combine core skills such as communication, interpersonal, professional skills, and our didactic and skill-based curriculum that includes foundations of CHWs, behavioral health components, clinic-based competencies based on CHW strategies with the goal of building not only CHW capacity, but their ability to serve their communities while assessing social determinants of health and addressing barriers which result in better health outcomes for all. So as we move forward, and you're going to see a little bit more of these more specific strategies, we will have Mr. Tone presenting on some of the strategies and tools covered during the training. Mr. Tone, Sam Tone, is your time.
Thank you, Mrs. Fernandez. As you guys see, this slide right here is very, very important for all of us community health workers to look at it. You know, when I see all these strategies and skills and competence on the list, I'm going to highlight a few of them just to give you guys an example. But the theme of this conference right here is community health worker like us bringing hope and care for the community. So when I look at all these this strategy and skills and competence on this slide, it brings me that word hope. Hope for me is help our people evolve. How can we help our patient engage in this strategy and skills and competencies? So for me, man, it's eye-opening for me because over here in South Central LA, the population over here is a lot of people that I deal with patients that come from prison, and there's not enough health system over here in LA. You know, that's a lack. That's a big issue. It is part of social determinant of health. So I have this patient that just got out 3 months ago, and he was locked up for 44 years. Came out, no hope, no sense of direction. He's scared, he's nervous. So when I did his assessment and I was talking to him, and he started, you know, balling up, he was crying. And for me as a community health worker, you know, that's our role, that's our job. We're here to advocate for them. We're here to accompany them, you know. So I assist these patients, sit with him, have a conversation with him. You know, imagine 44 years in prison. Come out here, you don't have no ID, no driver's license, no birth certificate. So this is why, you know, I love what I do. I always tell my coworkers, I don't like my job. I love my job. Because if you see your passion, you'll find your purpose. So within this hope that I was talking about, this like it summarizes everything that's in this slide right here. You know, the accompaniment, the visitation, the behavior change, the harm reduction, helping to see life from a different. So I just want to emphasize about that because my time is up. I'm going to give it to Mr. Porras.
All right, can we go ahead and go to the next slide? Perfect, thank you. So in this portion, we're going to take a closer look at the strategies based on the need in behavioral health, as we're choosing to focus on the behavioral health strategy. And we are familiar with these items, and I just want to jump around a little bit to highlight a few of them. We can start by looking at our role as CHWs. First and foremost, we are advocates for our patients. We are health coaches promoting a healthier lifestyle. And finally, we are capacity builders, giving them the tools not only to advocate for themselves, but to give them the capacity to search for and find resources that benefit them. We also have a series of skills and tools that allow us to find better alternatives. We are all familiar with motivational interviewing, or MI. This is a great place to start as we can find out where a patient stands and figure out how motivated they are to make changes. Next, we can use either the PHQ-9 or the GAD-7. These let us know if we need to continue probing to see how our patient is doing. We also have harm reduction. This is important because we can work on making changes that can be made despite having certain barriers in front in a non-judgmental and non-forceful way. We must remember that along with those skills, we have our mental health first aid to help us identify those initial issues and to see the red flags as they appear. We sometimes are so consumed by life and work that we often forget that we need to take care of ourselves. And the CREM, or Community Resilience Model, is a very useful tool not only for our patients, but for ourselves. When we begin to get out of our resilience zone, we are not doing the best for our patients. This is a great tool to share with our patients, the importance of identifying when you are no longer in your resilience zone. If you're not familiar with the CREM model, here's a brief explanation. There's a space in life that we call the resilience zone. When we focus on everyone else but ourselves, we tend to find ourselves getting out of our resilience zone. This can manifest itself as burnout or poor production. And we can easily change that by being able to identify it. So when we find ourselves coming out of our resilience zone, we can reset and find our way back. So that way we can better serve. And the last one that I would like to highlight is our behavior change worksheet. This is a simple way to set goals and plan with our patients. This will be outlined in the next slide. One of the things that comes to mind is we have to meet the patients where they are. These tools give us the opportunity to empower the patient, giving them the opportunity to succeed. If we can go to the next slide, please. All right, here's the behavior change worksheet. Let's go through it before we try and fill one out. So first we have our long-term goal. This can take anywhere up to a year. Our next is our short-term goal, anywhere from 3 to 6 months. Then we have our SMART goals, our short-term goals. They're specific, measurable, attainable, result-focused, and time-bound. Next, we have I know my plan is working when. This sets realistic small goals, such as going up the stairs without being winded. Next, we have barriers to achieve our goals. What are things that will be providing issues or becoming a situation, or it could be a person or a substance? Next, we have resources to address these barriers. What can we do to get around those barriers that come up? Are actions taken to achieve a goal? How is our patient going to achieve their goal? Actions taken by CHWs, us as the community health worker, how are we going to support and help our patients out? Actions taken by other participants. Maybe the participant has a family member or somebody that's going to be providing support during this time. This is where that person would go. Persons involved, pretty self-explanatory, right? And then how are they going to help? That's pretty self-explanatory as well. This is a great tool to use as it helps us set up your patient with short-term and long-term goals, and you can always make modifications as needed. We must remember this, and Ms. Ortega said this, and I loved it. Time is medicine. All right, so Mr. Sam?
Nice, thank you for that. So on this slide right here, we're looking at the vignette. This is an area we're gonna transition to application. We will be demonstrating the application of behavior strategy. So I'm gonna let Ms. Ortega read the vignette to us, and then after that, I will go with the portion area and then work it out to you guys. So take over, Ms. Ortega.
Thank you. Before I read it, this is an actual experience that our students actually go through, and we have two of our amazing graduates here who will again demonstrate a little bit of what they learned through the training. So you're getting a little piece of exactly what they go through in the training. So with that, patient is a 36-year-old male who identifies himself as biracial and has a history of sickle cell anemia since childhood. The patient complains of not getting proper sleep and states that the resulting tiredness has caused him to miss the last 2 appointments with his PCP. The patient has a history of non-compliance and has been reported as having the tendency to overtake his pain medication. He also reports acute anxiety and stress from the recent living arrangements. Patient reported increased drinking in the past month. His source of income is through SSI, and he states that he is unable to afford an apartment by himself. He has a father with whom he seldomly speaks due to the recent falling out, and the patient has been to the emergency department 3 times this month for sickle cell anemia crisis. Patient's next PCP visit is in 2 weeks. You were assigned as the patient's CHW. You will be applying patient-centered strategies to his case on scenarios 1 through 4. And I'll turn it back to you, Mr. Tong.
Thank you, Ms. Ortega. So as you guys see that there are 4 scenarios that we're gonna, talk about it and demonstrate to you guys how we go about to talk about health coaching and behavior change. So scenario 1, how will you assess patients, social determinant of health? Scenario 2, how will you build the patient's knowledge and skills, ability, capacity, patient's learning styles, and health coaching? Scenario 3, how will you assess patient's motivation? And scenario 4, how would you help patient create a behavior change plan? So in this section right here, I will let Mr. Porras, Kevin, do the scenario 1 and 2, and myself, I will do 3 and 4. Take over, Kevin.
All right, thank you very much, Sam. All right, so for the first one, how would we assess our patients' social determinants of health? First, as we look at the scenario, we have to see what is given to us, correct? The information that we have so far is that the patient is a 36-year-old male. He identifies as biracial. He has a history of sickle cell anemia. The patient has a tendency to overtake their medication. His recent living arrangements are causing him stress and anxiety. His only source of income is SSI, and he cannot afford an apartment by himself. So some of the things to keep in mind if we want to go off on a strength-based approach, we can reinforce the fact that he does have a space to live in. Even though it's not ideal, he does have a roof over his head. He also does have a source of income, which it could have been the opposite way where he doesn't have an income or no SSI. In this case, he does. We can also take the time to find out if he's willing to get the help and support to get him to his appointments on time, to make his appointments, and maybe he doesn't understand the way that he's supposed to take his medicine. That's why he's overtaking. So as we go into our home visitations, we can find these things out, and that way we can focus on making sure that we meet his needs where he's at. In scenario 2, how would you build the patient's knowledge, skills, ability, capacity, their patient's learning styles, or health coaching, right? So first, we must find out, how does our patient best learn? We are not given this information off the bat. So if we were going to go into scenario, we would be asking the question as simply as, how do you best learn? Do you know the different styles of learning? Are you auditory, visual, kinesthetic? Auditory means that you can hear the information and learn it. Visual means that you have to see it in order to know how it's done. And lastly, kinesthetic is learning by touching or doing it yourself so that you can learn it. These are forms that we can show our compassion and be advocates for our patients. We can ask about their environment. Is it okay in learning in a busy, loud space? Or is it better in a quiet space? Can there be distractions, or does it need to be a more controlled environment? Asking these questions will lead us to setting up our client for success. Next, we need to know how we can meet their needs. Are we focusing on items that are not important to the patient? How can we get the most out of our sessions, and what questions can we ask? It's simple as asking, are you interested in finding out how your medications work? Are you interested in learning more about sickle cell anemia? They do live with this. He has lived with this for his life, and now giving him the ability to understand his illness, maybe that's something that hasn't happened. Maybe he has questions that haven't been answered. And as CHWs, we have the opportunity to help in that capacity. Go ahead, Sam.
Thank you, Kev. On scenario 3, it say, how will you assess patient motivation? So this is the part that me and my instructor, Ms. Ortega, I remember this during the training. Man, it was fun with Dr. Mott. So Ms. Ortega and I will role play this scenario 3. How will you assess patient's motivation? So Ms. Ortega is going to be the patient. I'm going to be the community health worker. Hi, Ms. Ortega.
Hi, Sam.
How are you feeling today?
I'm okay. I'm a little bit tired and a little bit in pain, but overall I'm okay.
Okay. So let me ask you a question. Good that you feeling okay. I just want to ask you a question about how motivated are you to properly take your medication?
Well,
How
to be to how motivated I am, to be honest with you, Sam, I'm a little bit motivated. To be honest, like I am taking my medication. But sometimes, again, I have to be honest with you, sometimes I take too much and it's just, I'm overwhelmed. There's just so many to take and there's so many things I have to do. So I would say I'm motivated like a 5.
5? Oh, wow. Well, that's pretty good, because 5, man, that's because, the ruler from 1 to 10, the scale from 1 to 10 is 1 is, not motivated at all, and 10, motivated. So you halfway. Good. So, and why is a 5 instead of 3?
So instead of a 3, well, because I am a little bit motivated, but again, I just get so confused. I don't know what to take. And I think I need one of those boxes where you put all your stuff. You know what I'm talking about?
Oh, you talking about the pill box?
Yeah, that's the name. That one.
Okay. I'm glad you mentioned it because I have one over here for you. It's all color. It says Monday, Tuesday, Wednesday, Thursday. Because you need that. You need that, Ms. Ortega, so you can stay focused, so you don't overtake your medication. I think this is why you're tired. So the pill box is going to help you, organize your medication. So that way you take it on time, and it says MT. It show every day for you to, and so you can keep the lock on. Is that okay?
That's a good idea. Thank you.
Okay. I'm glad. We come to some agreement over here, Ms. Ortega. So keep up the good work. Okay, scenario 4. How will you help patient create a behavior change plan? So once again, Ms. Ortega and myself will role play that, but please go back to the previous slide. Please, thank you. So we're gonna talk about the behavior change plan sheets right here. So this is the part that community health worker work with the patient to help the patient guide the patient through the behavior change plan worksheet. So Ms. Ortega, okay, you see this the worksheet right here, right? This is something that we'll talk about the previous time that we visit. And this right here, you see the paper that we have long-term goals and also short-term goals. And long-term goals is from 6 to 1 year, to a year. That's a long-term goal. But short-term goal is, from 3 to 6 months. So this is your plan, not my plan. I just want to help you and walk you through this. So which one will you want to start it?
Okay, that's great. Yeah, I never heard of a plan. I never done a plan, so thank you for doing that with me. I think for a short term, I think I would want to start with the short term from last time that you and I talked. My goal is just to keep taking my medication.
Okay, that's good. So now we're gonna put down the started date. As you see, there's a SMART goal right here. And the SMART goal is all about for you to be more specific, it's measurable, attainable, and realistic, and time out. So that's good. That's a good start because, you need to take your medication to, it alleviate you from going to the hospital. Remember we talked about social determinant of health.
Okay.
So on the next one, it says right there, if you read it, I'm going through with you right now, you can look at it. It says, I will know that my plan is working when I see the result. Just give me one. Give me one. Excellent.
When I see that I'm taking my medication properly and not overtake, I think would be a good result of the pill box that you gave me last time. I'm using it, and I think a good result would be not me overtaking it.
Very good, Mr. Ortega. Okay, and then you see underneath that is a barriers to achieving goal. So what are some barriers? Just give me one example of what do you think the barriers to achieving goal?
One of the barriers I think is that I don't know when my medicine is gonna finish. So I think being able to get some help with that. You think you can help me?
Of course, you know, that's why I'm here, you know, to assist you and help you any kind of way I can. Okay?
Okay.
Okay, the resources plan to address barriers. How will you give me one example?
Well, can you be my resource as my community health worker? I don't know. I don't have many resources. I don't talk to my dad anymore.
Of course, that's why I'm here, Ms. Ortega. I would love to you know, help you, you know, fulfill your behavior plan, you know, because this is all about you, you know, to change, you know, have this plan in your life. So you see the other side on the right side of the worksheet, it say action taken to achieve goal. So what would be one? Give me a one good one. I know one, but I don't. It's you. You gotta tell me.
A good action, I think I need a plan. I need like what time I need to take all my medications. I have the pill box now, but I think I need a time sheet or something like that.
Okay. I want to keep calling you to remind you, you know, once a week so you can keep track of that.
Oh, wow. Yeah, you can do that. You can call me every week.
Okay. And then
Okay.
exercise. Okay. So I'm glad that this is what we go through to help the patient. And then you're going to sign it. I'm signing it. And then that way, you know that we're going to take care of your plan. Okay.
Okay, perfect. Thank you.
So next one, I will turn back to.
So I think, so this is a conclusion of a behavior change plan, again, that our students were trained to do, and now that they're graduates, they can continue to enhance their skills and ability to, again, at the end of the day, connect with their community members and being able to provide. And as we see also other actions that can be taken by participants, as you saw, you know, there's a medication, so also other parts of individuals who can help with this plan will be, you know, pharmacy. We saw that maybe this individual has help in the hospital. And again, community members should know that their community health worker is a resource to them, and they can offer a lot of support and linkages that way. So that is one of the prime examples that we can share with you all on how we train our students, and now again they are able to do it out in the real world. And with that, we'll go to the next slide. And we wanted to be able to leave some room and some time for our, again, graduates, our wonderful graduates, to share. So we got to see them in the professional world now, and we want to hear a little bit about personally how all of this has been able to impact their lives as well. So Mr. Porras, you can share your personal reflection with us. I think you're muted.
Kev, you muted?
Sorry. Yeah. Thank you, Ms. Ortega. A year ago, I didn't know I would find myself here. I was given the opportunity through my work at IHP to become a CHW, and it has been such an enriching experience. Although my current position is not as an active CHW, the tools and skills that I have learned have helped me develop my role in the community that I serve. I'm grateful for the Loma Linda San Manuel Gateway College and their team of instructors for their dedication to develop community health workers with a passion to serve. Thank you.
Thank you, Kev. For me, 4 months ago, I took this training with, you know, Promotores Academies, Loma Linda, and I have no idea, you know, this intense training, man. And I'm really, really grateful and thankful to you know, Dr. Lily Lee and the staff, especially Miss Fernandez and Miss Ortega and Dr. Ma, for giving me the knowledge and the skill that I learned today, to be a better community health worker over here in South Central LA. It's a overwhelming position that I'm in, but I love what I do because I can relate to a lot of patients that I deal with today. I have special patients today. I deal with everybody that come out of prison. They're in the program. They need some direction, for their future, that kind of stuff. So it really makes me appreciate this position as a community health worker. And I just want to, thankful to the Loma Linda staff for giving me the opportunity to grow and mature and utilize all these tools and skills and experience for me to engage to the, to my patient, especially the community, because LA, we need a lot of help. We need more community health work over here in South Central LA. Challenge, very challenging every day, but I'm grateful. Thank you for your time.
Thank you, thank you. So at this time, we are almost concluding our presentation. We just wanted to say thank you, and we wanted to provide some home points with you all today. But before I do that, we all went through a kind of like a baseball game, as I like to mention. Our presenters here, Mrs. Fernandez took us to first base. I took us to second base. Students took us to third base, and when bases were all loaded, we did a home run, and you all got to see their personal reflections as well and their personal stories. And hopefully you felt the fireworks that a lot of this work that they do is comes again from passion. As we heard this morning or this afternoon, our keynote also said it, right? Together we can, and that's the title of our presentation as well. And together, community health workers need a lot of support. The leadership who want to support community health workers also need a lot of support. And this, again, is more than a job. It's a labor of love for community health workers, is a calling. So we can also continue to support and building those capacities, because once we know that we can support community health workers, individual, them themselves, they can also ripple that effect and impact into their communities, and then create healthier communities that way that will thrive and create those fruits that we're talking about. And then again, I just wanted to say thank you for Dr. Leon and Dr. Lee for also being here with us, as they are our leadership, and thank you for all your support as well that we as instructors can't provide for our community health workers, that leadership as well. And as Mr. Porras said too, right, time is the medicine. So community health workers, if you take anything with you, community health workers have the time to work with your community members, your patients, and they will foster that like anybody, like nobody's imagination. So thank you so much again, and I think we'll leave the rest of the time for Q&A.
Yes, we have some questions in the queue. The first question asks, can you elaborate on what you mean by medicalizing social determinants of health, and why CHW should try to avoid doing this?
So I don't think we said medicalizing. I think someone probably took it that way, but we don't. We want to really focus on that 80%, right? Mr. Tone, Mr. Porras really mentioned it. We want to work on the strength base of what we see our community members have, and being able to again focus on that 80% that we know their health is determined by where they work, how they eat, if they have access to transportation. We want to focus on that, and us not being able to medicalize that, because then also community members know the difference and know that you're assessing, right? We are assessing one thing or the other, and when the community health workers assess, they do it again in a very bilateral. I'm not, for me, for example, when I used to work with pregnant moms, I've never been pregnant myself, but I would always share, as much as you're going to learn from me, I'm going to learn from you, and create that relationship day one. And that trust is just incredible. So yeah, I don't know if I answered that fully, but or if you have anything else to add, Dr. Lee.
No, thank you. I know for, when we talk about medicalizing, we talk about prescribing some kind of a, prescription to be able to, resolve some medical conditions. And social determinants are multifaceted and a very dynamic process. And even though it might fall within the category of education, access to health, income, it looks very different from one person to another. So it's really difficult to prescribe it and make one size fits all, which is the reason why CHWs really further grow in enhancing their own skill sets in learning how to work through a behavior change plan. And they recognize that a behavior change plan exercise with one patient or client looks very different to the next because of the different layers that we each bring. The other question is, were you able to work, this is to Sam, were you able to work with the men and women just prior to them being released from prison? Are you able to respond to that, Mr. Sam? Oh, could you unmute yourself?
You're muted.
Oh, sorry. Before I became a community health worker, I only worked this organization a year ago. But before that, I was a mentor for a lot of gang members, and I worked with the troubled youth, in LA, South Central LA, because this environment right here is a lot of gang invested, and kids live with fears and all that. So they used to call me, and and last year before the pandemic happened, I went back to prison to speak to the population over there, just to keep them fresh hope, to let them know that there's a right way to live life. And and even in there, we need to carry the message to prison, because in there, the social determinant of health impact in the prison system in a negative way. So yeah, I hope I answered your question, but that's what I used to do before I became a community health worker.
Thank you. Another question is, thank you. This is great that you are doing a role play. What is the methodology that you utilize to train and ensure that your CHW screen the client's patients without medicalizing and becoming box checker workers, or to be biased and identifying the client-centric needs, wants, and goals? Also, do you communicate these plans with the PCPs or other medical providers? Would anybody like to take that?
I may answer maybe a couple of the first two, and then I will pass it on. If the first one, what methodology that we use to train and ensure the CHWs? So our CHWs that come through our doors come from different settings. That's one thing. So a lot of them, they are working at the clinic setting. Some are working at the community resource centers, other are the school-based, clinic-based. So it differs. So the tools that we give them are general tools. They are foundation tools that they can then utilize and adapt it based on their role at their site. So definitely we use a lot of role playing, because some of the CHWs have never seen a clinic-based scenario when we talk about medication review, for example. So we do introduce medication review, and medication review have different elements where the CHW can assess first definitely motivation, also adherence. They are assessing for resources, barriers, and so on. So they oversee the whole picture, And we do not train them into just checking a list, because they have to understand each patient and how they come and what the patient's needs are. And another component that we do have in our training is, if they're working as part of a care team, that interaction, that dynamic is crucial for a CHW. So they have very close communication, and we encourage for students, for CHWs, to have that very close communication with the nurse, with the care manager, the behavioral health member. So they are not calling the shots regarding medication or regarding other things that are not within their role. So I hope that answers some of the questions. If anybody in the team would like to add as well.
Yeah, I can take the baton from there. Thank you, Pamela. I know that Kevin and Sam are currently not in a complex care team environment. They have a very specific targeted role that they are functioning in their current employment. But we do have community health workers who are part of a health home program, which is a program comprised of 4 nurse care managers, care coordinators, behavioral health specialists, and CHWs. So with CHWs who are working in that quad model, do work with providers to exchange the information that does come from the worksheet that you just saw, to be able to further understand the context of the different social determinants of health, barriers and strengths that may help or be a barrier to furthering in their care plan. So that's how they have utilized these tools. When it comes to the methodology, we actually have recently published a paper where we do talk about the delivery methods and the different premises of the skills lab. And I have shared them with our organizer, and I believe she has posted that just now to the chat, the training model and methodologies article. So you're more than welcome to read that and let us know if you have any more questions about our methodology. The next question, great presentation. What was the resiliency assessment you used?
So that was the community resiliency model. We spent 2 days working and not only just learning it, but testing it out with ourselves and with our classmates, where we got an opportunity to identify some of the things that can trigger us and put us in a position where we are outside of our resiliency zone. The app that they use is the iChill app, ICHILL. It's a free app. You can use this, and it kind of breaks it down for you. It gives an explanation on the resilience zone, some of the skills that you can use, and how to use that, and you can share that with others. I know I've shared it with other people after we've been done with the class, and a lot of people have taken some benefit from it. I know I have, and it's something that I personally use on a regular basis.
Thank you, Kevin. Another question, equity is different geographically, culturally, racially, across income brackets, etc. How do you start to define equity for all these different cases when working as a CHW within communities to provide health equity, transportation equity, energy equity, education equity, etc.? So Sam,
yeah, and I think and I'll give it back to the graduates, but I think we fully trust in them that they know their communities way much better than we do as instructors and as trainers. And we just encourage them to, again, do windshield surveys and things like that, where they can really see the social determinants of health and be able to assess that. So if Mr. Porras or Mr. Tone would like to share more.
So I work at the Community Resource Center in Riverside. Even though the needs are different than in another site, when people come in with needs. So one of the things that we had mentioned is we meet the people where they are at. Whether it is that they need food, whether it is that they need assistance in a different capacity. We do our best to, one, listen, and then find resources and things that will benefit them so that they can reach and find that equity and that they're looking for.
Thank you. And I think we're out of time, so we're going to pass the baton to Bernadine.
Thank you so much to our wonderful presenters, and thank you to you, the audience, for joining us. Before I let you go, I would just like to remind you that training model and methodologies is in the chat. And also, if you look at your toolbox, there is a tab called handouts. So for anybody wondering if they could get the PowerPoint presentation, if you just click the little arrow next to handouts, you can download the PowerPoint. So I'll give you another like 30 seconds to do that before we close out the session. But otherwise, thank you so much for joining us. This will be recorded and made available post-conference. So everybody will receive an email after the conference letting you know where you can watch this again. But thank you so much, everyone, and have a great rest of your day.
Thank you. And our contacts are on the slide, on the final slide as well, if you need to contact us or need more information on the training. Thank you.